Hi, I'm Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, and we're doing another of our Facebook Live sessions tonight. We've been doing these now for about 15 months, and the good news is the number of questions and the amount of concern is declining, and that is the best thing, because I think we really are trying to get near the end of this pandemic, and that would be a good thing. So tonight, we'll go ahead and do as we always do, is look at the world situation and move down to the local situation, and then we're also going to go ahead and take your questions. So if you have questions, put them in at Facebook questions at douglaspublichealthnetwork.org, and Vanessa and one of our team will get to them. And then if you have other questions, put them in the chat session of Facebook Live, and we'll try and get to them. So as always, we start at the world view. And the good news in the world is that both cases and deaths are down. We clearly had a fourth peak, which happened in the late springtime, but that is clearly going down in most of the world. So in much of Europe, much of North America, and much of Asia, there's very little disease, but there's still some places in the world that are a little bit worrisome. So South America is worrisome because South America has had an outbreak of COVID now going on for months and months and months, and some of the case rates in those areas are still extraordinarily high, with a case rate in Uruguay over 100 cases per 100,000 per day. That would be like us having 112 cases a day every day for weeks at a time. That's shocking and really problematic, and doesn't seem to be getting much better in South America. Europe seems to be quiet, although we're a little worried about the United Kingdom. So the United Kingdom, as you know, had a big outbreak in the spring of this year. They then got totally into vaccination, and they got a lot of people vaccinated. But now they're seeing the new Delta variant, which is the 617 variant that originated in India, come to the UK, and it's pretty much squeezed out the previous B117 or Alpha variant that was there. And it seems to be causing a lot of disease, especially in younger people. Now, they've not had a tremendous number of hospitalizations, but they're having an upswing again in disease, despite the fact that they're highly vaccinated and they've been pretty much in lockdown for a little bit. So that's a worrisome area. The other area that's concerning is Mongolia. So Mongolia, a little almond-shaped country between China and Russia, which has been highly vaccinated, also has been struggling, we also think, with the 617 variant, but the data on that is not clear. India, which really struggled about a month ago, may be starting to quiet down, although I was just listening to a story on the radio today that when they actually count the number of deaths, the number of deaths is far higher than they originally thought, because many people did not go to the hospital. Many people were cared for at home and died. So I think we're going to see an increase in the number of deaths attributed to India. And then again, I always worry about Africa. Again, Africa, a continent which has had very little disease through the pandemic, so there's very little natural immunity. So there's very little natural immunity. There's very low vaccine rate, and they've got really a terrible healthcare system. So put all those things together, you could easily have spread in Africa. And Africa also has some of the biggest cities in the world. So when you look at some of these cities with more than 10 million people, things could spread very, very quickly in those areas. So we worry a little bit. But except for this very southern part of Africa and the very northern part of Africa, it's still quiet, and we hope it stays that way. In the U.S., the number of cases had been going down for about the last 6 weeks and has now flattened at about 4.3 cases per 100,000 per day, which is still a pretty low rate, which is much lower than any rate we'd had for the last year. But we're still having over 10,000 cases a day and over 350 deaths a day. Still a lot of cases, a lot of deaths. And I know we're sort of congratulating ourselves on how well we're doing, but if we had anything else that was causing 350 deaths a day, we would worry. I mean, to put this in perspective, things like motor vehicle accidents, about 100 deaths a day. Murder is about 100 deaths a day. Gun accidents, lower than that. Other natural disasters, much lower than that. And yet, you still hear on the news about shootings, you hear about murders, you hear about these other things. So we've grown kind of complacent at this level of disease. In the U.S., there are a couple of states that are a little worrisome. I think Wyoming is somewhat worrisome. Texas is worrisome, because we've seen an increase in that panhandle of Texas, an increase in Wyoming. We're starting to see a little increase in Louisiana and West Virginia. So these are all areas that are a little bit concerning. And today the U.S. recorded that 600,000 deaths. So 600,000 deaths from COVID since the beginning. It's a lot of deaths. When you think of it and compare it to wars, for example, deadlier than any war since World War II. So this really is a lot of deaths, and we are certainly glad that this is mostly in the rearview mirror. And today, the biggest states, California and New York, are starting to open up. They both have very low rates of disease, below the national rate, and they're beginning to open up today. But I think we have to worry. I think variants could come in and could certainly change all of that. Oregon continues to go down. We're at about 6 cases per 100,000 per day. The hot spots in Oregon tend to be places that were cold spots before. So if you remember early on, the disease was most prevalent in the Tri-County area and the upper Willamette Valley. Now the disease is most prevalent actually in Douglas County and eastern Oregon, places that didn't have much disease before. So Oregon is about 6 cases per 100,000 per day. Douglas County about 14 cases per 100,000 per day. So considerably higher than the rest of Oregon and considerably higher than the national average. When we look at Douglas County, we're seeing outbreaks in a couple of things. There's mostly younger people who are in the outbreaks. They're associated with social gatherings, with work, with school, those kinds of things where people gather. And the thing that's absolutely remarkable is they are overwhelmingly among the unvaccinated. So in the last 2 weeks, over 200 cases, only 2 of those 200 cases were in people who were vaccinated. All the rest were in people who were unvaccinated. So it is really very, very clear that the vaccine does seem to be protective, but that the attack rate, that is, what's your chance of getting infected for those people who are not vaccinated, is just as high as ever. So there's about there's maybe 60,000 people who are not fully vaccinated. And so for us to have 15 cases a day among that 60,000 would give an attack rate which is over 20 per 100,000 per day, which is higher than we've ever seen. So the disease is still out there, and again, it's mostly in young people. And you say, well, young people don't get very sick, but they do. We're seeing them in the hospital, we're seeing them very sick, and we're even seeing ICU admissions for some of these very young people. So over the weekend, I always look at this kind of stuff, and I looked at the people who were in the hospital. There was only one that was older than me. Everybody else was younger. And I consider myself to be pretty young, so that everybody else being younger than me suggests that it's pretty awful. Okay, let's get to our questions, and then we'll do that. So are you doing in-home vaccinations yet? Yes. For people who are disabled and can't get out? Yes. So we've been doing this actually for several months. We have a contract with one of the local ambulance services, and they will come to your house and do those. Now, we can't do those for everyone because it takes 2 guys a whole hour to get this done. But nonetheless, for people who are truly disabled and can't get out, we do have that service. So call your doctor or call our hotline at 541-464-6550, and we'll see if we can get that arranged. So if 3 people are in a boat per day and 2 of the 3 are vaccinated and 1 is not, is that something to worry about? So, well, it depends upon what you're doing, right? If you say that this is a cruise ship where you're in a tiny little unventilated cabin, that would be problematic. But if you were truly outdoors, outdoors we think is really safe. 2 or 3 people vaccinated also makes it safer. It would be safer if all 3 were vaccinated. But in the whole scheme of things, from quite unsafe to safer, that's more towards the safer side. So with the mixture of vaccinated and unvaccinated people and different variants, is there a safe way to open things up again? Well, I think the American public has decided that unvaccinated people and variants be damned, and we're going to open up no matter what. And so I don't think the tide of opening can be stopped. So I think people in the U.S. are not willing to close things down. Fewer and fewer people are willing to wear masks. And so I think, regardless of what we think, I think things are going to are going to go up against. Well, what can you do? Well, there are a couple of things that you can do. One is first to get vaccinated. The second would be to create a fortress of vaccination around you. So if you're vaccinated and the people around you are vaccinated, the chance of you getting the disease is much less. I still avoid high-risk situations. So I would not go to an indoor concert. I still probably wouldn't fly. So there's still some things, some high-risk things I would avoid. But would I go outside for a bike ride? Absolutely. Would I go to a restaurant where there was adequate distancing? Absolutely. But I'd be really nervous about long-term indoor things because that's a risk. I think so the question is, what will the variants be? If the variants are biologically fascinating, which they already are, that this germ should be able to change so quickly and in so many different areas of its genome is really pretty darn amazing. And so if it just stayed as the original disease, we could really put this in the rearview mirror. But I don't know about what's going to happen with the variants we have now. Now, the good news is that there's increasing data that the vaccines work, not quite as well, but work against both the 351, the beta variant, and the 617, the delta variant. And they work well. Not great like they did before, but pretty well, and much better after 2 doses than 1 dose. So they work pretty well. But the concern is that there's a new variant, and there will be, just like there'll always be a next hurricane after you get through the letters, there's going to be a new variant. And if this new variant is less amenable to the vaccine, we really could be in a tough way. But I don't know. I mean, I cannot predict that thing in the future. Is there another variation of this virus that'll make it resist the vaccine? So does being vaccinated make you unable to be COVID tested? No. So the COVID tests look for either the RNA in the sample. That's how the PCR tests work, or they look for the protein, and that's how the antigen tests work. The vaccine does not affect any of the tests that are out there. So the vaccine does not interfere with any of the tests that are out there. So yes, you can get tested. The only test that it changes is your antibody test. So once you get the vaccine, your antibodies go up as you would expect it to, and that's the only test that it changes. Well, in terms of new vaccines, there is some new vaccine today. There's a new vaccine that got study release this week. It's called the Novavax. Novavax is made by a company in the U.S., in Gaithersburg, Maryland. This vaccine is a protein vaccine. So we now have 3 different kinds of vaccines in the U.S. So we have the mRNA vaccines, the Pfizer and the Moderna. We have the attenuated viral vector vaccine, which is the J&J, and in Europe is the Pfizer. And now this one is a protein vaccine. So the way you make these is you find the spike protein, you grow that spike protein, and now you put that spike protein injected in people, and people make a response. That is the traditional way we've made vaccines for many years. So if you ever gotten a hepatitis B vaccine or hepatitis A vaccine, any of those kind of vaccines, those were protein vaccines. The good news on them is they've got a long track record. The other good news in them is that they might have slightly less reaction than the mRNA vaccines. The bad news is they take a long time to make. And so early on in this, when people said, oh, it'll be about a year for the vaccine, because they knew how long it took to make a protein vaccine, which is about a year, and we're just now about a year, so they were right. I think we were all surprised at how quickly the mRNA vaccines were made and how effective they are. But if you're a traditionalist and say, I don't want any of that new genetic stuff, Novavax may be the vaccine for you because it doesn't have any genetic material in it. All right. So Veronica says, why wouldn't I fly if you're vaccinated? So it's actually not the flight that worries me. I think the concern of the flight is low, but it's all of those other things that go around it. So, over this last year, I've grown a little skittish of crowds, and so I'm not yet ready to fly yet. I think others who want to fly, I'm certainly not saying they shouldn't. I was talking about my personal risk preference. So someone says they live in HUD housing, and someone came in for an inspection and they were not vaccinated or wearing a mask. Well, they should then not be in your house. So still the rule in Oregon and the CDC guidance is if you're fully vaccinated, you do not need to wear a mask. But if you're not fully vaccinated, you should be wearing a mask, and they should. So the question is, what's the viral load in the air in my apartment? Well, if they were infected and came into your house and they were at the peak level of infectiousness, that would be an issue. So, and that's why during the pandemic, this is how people got it. Somebody came to visit. They had the disease. They didn't know they had the disease yet. They were at the peak level of infectiousness. They stayed for an hour having tea or playing cards, and then they left, and then the person at the house got it. So if you were going to do it, so that if you were going to be safe on that, what I would do would be to open the windows, turn on the fans, leave for 3 hours, and come back, because we know that ventilation works very, very, very well for this. And that's why flying on the plane itself is relatively safe, because there's very good air handling there. What we're beginning to realize now is that ventilation was truly important during this. So when you look at places where this spread, they were typically places that had very poor air handling. And you say, well, what's good and bad air handling? So air handling usually could be defined as the number of air changes in a room per hour. So the room we're in now is probably about 12 by 15 with, say, 10-foot ceilings. So, you'd measure what the cubic feet are, and then if there's an air handler in there, you'd figure out how many cubic feet per minute it handled. So let's say it's 100 cubic feet per minute air handler, which would be a pretty good size air handler. And in here was you have to help me with the numbers here, was 10,000 square feet. It would take 100 minutes to go ahead and do the air change. And 100 minutes would mean that there would be about 2/3 of an air change an hour. And so that would be actually typical for residential construction. When you start to get higher and higher levels of air exchange, like in an OR, it's about 15. Hospitals overall usually about 8. Grocery stores, interestingly, about 8 or 10. And you say, well, why do grocery stores have such great air handling? One is they're big, right? So there's a lot of volume there, and grocery stores hate to have bad smells. So I'm sure there's something in the produce section which doesn't smell good, and if you could smell it, it would obviously turn people off. So there's very good air handling in places like that. So in this case here, in your apartment, that would be it. So somebody says they were wearing masks. So they were wearing masks. That would be helpful. But we think, again, masks are a little bit of the issue, and it's adding all those things together. So getting vaccinated, wearing a mask when you're in an unknown situation because they didn't know what your vaccination status was, and good air handling and good ventilation all add together. So are there any vaccine clinics this weekend where I could get my kids vaccinated? If you call, there are a bunch this weekend, but I don't know exactly where they are. I know one of them is going to be over at the Chainsaw Festival in Reedsport. So if you've never been to the Chainsaw Festival, that is a hoot. These guys, mostly guys, but some women, take these hunks of wood and with a chainsaw carve the most amazing things. I mean, I have an incredible hard time making anything much less difficult than that. And these guys, these people who do this are really amazing to watch. So we're going to check this out. But if you, again, will call our hotline tomorrow, 541-464-6550, we can do it. If not this weekend, certainly on Friday, you can get these vaccines over to Aviva. Aviva has a clinic that runs Monday through Friday and some Saturdays. So I was there 2 Saturdays ago, and Jay Richards was there this past Saturday. But certainly Monday through Friday. And if you call tomorrow to the hotline, we'll know the number. Okay, so what else do we have? So I had a note this week from a very nice fellow who sent me a long note about something we wrote about breakthrough rates. So breakthroughs are cases where people have been fully vaccinated and still get the disease. Previously, we used to call these vaccine failures because every vaccine we've ever made has some failures. We used to call them vaccine failures. With COVID, we've called them breakthroughs, and the CDC has very strictly defined breakthroughs as a case that shows up 2 weeks after your last vaccination. So for the Pfizer and the Moderna, it's 2 weeks after your second dose. For the J&J, it's 2 weeks after your first and only dose, and you would get a case, and they call those breakthrough cases. Now, some of those cases get reported, some of them don't. I mean, there's some municipalities that don't look very carefully at the cases and don't look at the vaccine status, so they could certainly be more than the number of cases that are reported. In Douglas County, every single case we look for the vaccine status. And we have a way to look for the vaccine status for everyone in Douglas County. And so we do look for that thing. And so we know the number of breakthrough cases. And in a typical week, it's 0, 1, or 2. And I will tell you, this week we've had a few breakthrough cases. And we worry about that because in the past when we've seen breakthrough cases, they were usually associated with variants. And there's one variant, especially the P1, also known as the Gamma, which does seem to cause a lot of breakthroughs. And that is a problem. So we're going to, on these cases where we've had breakthroughs, we're going to look carefully to see if those were the P1 variant. And that's my concern, right? So if the vaccine worked as it did before, 98, 99% of the time, and enough people got vaccinated, this disease would go away. But if the vaccine efficiency goes down to 70 or 80%, it's going to take a lot longer for it to go through. So in terms of breakthrough, there's not a standardized way to calculate breakthrough rates. And so what we're going to report is the number of breakthrough cases, clearly a standard for that, and what the vaccine efficiency is, or the vaccine effectiveness. And there's a way to calculate that with the attack rate in the unvaccinated group and the attack rate in the vaccinated group, and you can mathematically figure out what that is. And we do. Our vaccine effectiveness, when we looked at each of these little times, has been well above 90, and in fact the last time we looked was about 98%. So the vaccine seems really effective. So this question strikes near and dear to my heart. So Veronica says, I'm not vaccinated. I'm trying to decide to fly to my mom's house. It's a 5-hour flight. Do you think it would be careless if I double mask, trying to decide if I should just drive? So this strikes home because my mom, who is 91, is about a 5-hour flight away in Washington, D.C., and we're having a little bit of a family reunion on the June 19th, and the question, I think so I'm not going to go, but the question is, should I go to that thing? It would involve flying and whatever else. I decided against. However, my wife really wanted to go back and see the grandkids, so she did, just as you suggest. She drove back east and took a couple of days, more than a couple of days, to drive all the way back east, because driving and staying in a motel prepaid, just getting drive-through is a relatively safe way to do it, and she's also vaccinated. So I would tell you the difference between a 5-hour flight and driving, it's a tough decision, and I wouldn't make it for anybody else. A lot of it depends upon how much you want to do it and what your risk tolerance level is. Now, obviously, there are a lot of people out there who have a really high risk tolerance level. They're unvaccinated, they go out to big parties, hang around with lots of unvaccinated people. They're taking a relatively high risk. And then others who are a little more on the cautious side, and I guess I'm a little more on the cautious side at this point because I do have this important job, and if I get sick, then it's not like we have 6 health officers behind me ready to go. So I've been really careful not to do it. So would it be to double mask? Well, double masking would be helpful, but actually if you're going to do it, what I would recommend that you do is get a good quality N95 mask, and you can get them now, to get a good quality N95 mask, wear that N95 mask anytime you're around anybody else. That would probably be the safest thing. And if you could get a vaccine, that would be great. So Nika says, does having a poor immune system make the vaccine less effective? So the immune system is a phenomenally complicated system that is really hard to measure. So the immune system has a number of parts. It's got antibodies, which are proteins in the blood that circulate around, getting rid of stuff. Antibodies we understand pretty well and are very easily measured. But then there are these T cells and B cells which are the ones that actually coordinate the immune response. And T cells and B cells are way complicated. There are a bunch of different kinds of T cells and a bunch of different kinds of B cells, and they all work together in this incredible way to go ahead and do your immune system. And so there are a lot of immune problems out there, and when we look at immune problems can be anywhere from you don't have any antibodies. And I have one little patient that I take care of has no antibodies, and he was very prone to getting pneumonia, and we figured it out, and he now gets an infusion of antibodies once a month and has been totally healthy. So that's the easiest part. But the T cells and the B cells are really, really hard to figure out. And when we look at immune problems, sometimes it's simple, like not enough antibodies, but sometimes it's complicated. Because when we look at diseases, autoimmune disease, which are unfortunately common, like lupus, like rheumatoid arthritis, in some ways, their immune system is too active on some things and then not active enough on the other. And the treatment sometimes for those are medications that knock out or knock down your immune system. So people with rheumatoid arthritis may take one of these things like Humira or something, or they may be on prednisone, or they may be on methotrexate, all things which dampen your immune system and dampen your immune system response to the disease. So your lupus may get better, your arthritis may get better, but you might also be more prone to other kinds of things that your immune system should do. So the whole immune system and the effect on the vaccines is very, very complicated. I looked this up and in some great detail. It turns out that there's some medications that you might take, high-dose prednisone, some of these other things that really decrease your immune system that may make it so that your body's reaction to the vaccine will be less. And I know there are a bunch of rheumatologists who are recommending either a change in the kinds of medicines you take in the week before and the week after you get your vaccine. Some have recommended getting a third dose, although that's not totally well accepted. Some have recommended doing antibody levels. But there are so many different variations of immune problems. So in pediatrics, we see some. I told you about the little kid who has no antibodies. That's rare. But the other one that I see is a lot of people with allergies, right? So allergies are an immune issue. And what allergies is a very heightened response to something that is not really a threat. So ragweed pollen or grass seed pollen is not really a threat to my body, but if you're allergic to grass seed, your body makes this all-out response to go ahead and do that, so you get the runny nose and the sneezing and whatever else. Allergy to peanuts doesn't serve any logical function that we know of, and yet your body makes this incredible response to that. And then we have kids with autoimmune disease, so we have kids with lupus and erythrocyclitis and other kinds of issues that we do that, and we just don't know enough about this. So I would really talk with your rheumatologist about this. But this is why what we really want is for enough people to get vaccinated, because for some people we know the vaccines aren't going to work very well. So I have two little kids that I take care of that have heart transplants. Their immune system is really knocked down by the drugs we get them, so they won't reject their hearts. And these drugs that we give them that really knock back their immune system probably also knocks back their response to this vaccine. So they probably get less response from the vaccine. So they should still get the vaccine, but the other thing they should do is they should surround themselves with other people who are vaccinated so that they don't come in contact with the disease. And that's the other things that you can do. All right, so we may have heard this week, there was some talk about myocarditis and pericarditis. So myocarditis and pericarditis are inflammation, myocarditis of the heart muscle itself, pericarditis of the sac that covers the heart. So if you ever look at a heart in operations or in an autopsy, heart's about the size of your fist, and then it's covered with this fairly tough sac. And the tough sac that it's covered with is like ripstop nylon. It's really pretty tough, and the heart beats inside this sac. What you see when you have myocarditis or pericarditis, and there's a little bit of fluid in that area between the heart and the pericardium. Sometimes that pericardium gets thickened, and sometimes you get changes in the heart muscle itself. So what we've noted is there are some cases of myocarditis that are associated mostly with the mRNA vaccines, mostly in younger people, mostly in boys, and mostly a few days after the second shot. This, again, is not surprising in that there's a lot of myocarditis associated with the disease, so that you might have some very mild cases of myocarditis associated with the vaccine is not only not surprising, but somewhat expected. Because when we get any vaccine, you'll sometimes get some symptoms. So the MMR vaccine, which we've been given for many, many years now, over 50. So we've been given the MMR vaccine for a very long time. And what happens on the MMR vaccine is you get what is the equivalent of a mild case of measles. So kids get the vaccine, 8 days later, it's not uncommon for the parents to call and say, oh, they've got a little bit of low-grade fever, and they got this funny little rash, and you go and look at the rash, and what they basically have is a super mild case of the attenuated measles that they got from the vaccine, because that's how the vaccine works. And in the MMR vaccine, you get basically a mild case of the measles that gives your body an immune response, and then you do better. So that we see a little myocarditis, but the myocarditis from the disease is so much worse that we are still recommending that. All right, a couple more things here. Get your questions in, or we'll get going here. All right, so one of the other things that came up was about deaths. And so we frequently hear, well, is every death that happens being considered a COVID death? No. The only deaths that are even considered in the COVID range are when people have a positive test for COVID and they die. So it's not like everybody who has a car wreck who dies, they say they have COVID, because you have to have a positive test, and the only way to get a positive test is to have or have had the disease. So not an antibody test, but you have to have a positive either antigen or a PCR test. However, not surprisingly, when there's disease around, there are going to be some diseases where people have a positive test, but the COVID itself didn't really cause their death. I mean, you could, for example, have COVID and get killed in an auto wreck, or you could have test positive for COVID and die of something else. And so we look at each of our deaths very, very carefully. And I was originally concerned that we would have a lot of deaths with COVID, but not really due to COVID. And so I get a chance to review the medical records on almost all of the cases. And when I review the medical records, strikingly, almost all of the deaths are very clearly due to COVID. So as the person had other underlying conditions or whatever, got COVID, got sick with the COVID, had typical symptoms of the COVID, went into the hospital, had both a positive test and other things that go along with COVID, this ground glass appearance in the lungs, a high need for oxygen, and then most survived. But the ones who died obviously died of COVID. Now, doing death certificates is very, very, very complicated. This is not like CSI or NCIS, where they seem to do an autopsy on everybody and get the results back in a day. Very, very few people in the U.S. get autopsied. The only autopsies that are done are in high-profile celebrity cases, high-profile police cases, and that's about it. So the number of cases of autopsies that we do in Douglas County is only a few in a year. We have 1,000 people die, and only a few a year actually get autopsied. And so most times you have to sort of figure out what happened. So let's take somebody who got in a car wreck, broke their leg, and then later on died of a pulmonary embolism, which is a clot that started in the leg and then moved up to the heart. That death certificate, what would that say? So if you did that death certificate correctly, you would say that the death was due to pulseless electrical activity. So pulseless or cardiac arrest or pulseless electrical activity, meaning that there was no blood for the heart to pump because of the pulmonary embolism. So it would be pulseless electrical activity secondary to a pulmonary embolism, which was secondary to the broken leg, which was secondary to the auto accident. So there's this sort of chain that went through it. Had they not had the auto accident and broke their leg, they presumably would not have had a PE and they wouldn't have died. But the cause of death is not the motor vehicle accident, but is the cardiac arrest or the pulseless electrical activity. Similarly with COVID, when people die of COVID, so let me give you the typical example, 70-year-old person gets COVID, they're sick, they're a little sicker, they go to the hospital, then they have pneumonia, not infrequently they have some clotting or some renal disease, and then they may just have increased respiratory problems and then die of their respiratory failure. So their death would not say death due to COVID. What they would say is death due to respiratory failure. Respiratory failure caused by an interstitial pneumonia, which is the kind of pneumonia, or a COVID pneumonia. So respiratory failure caused by pneumonia, secondary to COVID, and you might have some underlying conditions like previous history of Hep C or something else. All of that would be recorded in there. And the question is, how do you put these together? So when we look at these, we look at all of those, and of the 80 or so deaths that we've had, I would say almost every one is a clear path between their COVID diagnosis and their death. So this was not the car wreck that we happened to find on death that we did this. Now, of the 80 cases, there are perhaps one or two where it's not clear that the COVID really had any difference in it, but they still get counted as a COVID death in Oregon, because if you have COVID and then you die within 60 days, it's considered to be a COVID death. But I will tell you, this idea that all the deaths out there are all due to COVID and none of them really got sick from COVID is definitely not true. And I can't show you the death certificates because nobody else has permission to do that. But I can tell you, looking at death certificates and looking at this, almost all of those deaths, clearly COVID was part of that goes on, but not all. There's the occasional person who would have COVID, not even know about it, get in a car wreck and die. That would be associated with COVID, but clearly, I think in that case, not due to COVID. Okay. All right, well, that's it for questions. Thank you all for joining us. Again, the vaccine seems to be so phenomenally effective, and we really want to get enough people vaccinated before the variants start to arrive, because if we have a large number of unvaccinated people when the variants will arrive, we're going to have a lot of disease, and it's going to be really hard to stop. So what we want to do is get enough people vaccinated so the rate of disease goes really low, so that if and when the variants arrive, that we'll be ready to deal with it. We have vaccine events. Almost all the pharmacies have it. All of the big clinics have it. As I said, we're going to be at the Chainsaw Festival this Saturday. Aviva has a clinic that's open every day. So if you're on the fence about getting it, get it. And this is the week that I have tried really hard with people I know to get them off the fence. So I spent hours this week working with people who were on the fence for one reason or another. And I'll give two stories. So one person was somebody who was very worried because they had bed allergies, and they've had reactions to all kinds of different things. And they were worried if they got one of these vaccines, either the Pfizer, the Moderna, or the J&J, that they'd have an allergic reaction, and that could be problematic. So what was the advice? So I went through, and this person did have a significant history of allergies, but even in people with a significant history of allergies, the risk of COVID is far greater than the risk of the vaccine, because almost all of the reactions to the vaccine are relatively easily treated with epinephrine and Benadryl and other kinds of things like that. So what I recommend is that she get the vaccine at a trusted place, hang out for a few hours afterwards, be sure that everything was good, be sure that the place they were doing it had epinephrine and Benadryl, which they all do, but be sure that they were all ready to go, and I encouraged her to get her shot, and she did, and she did great. Another couple of people were worried about fertility. And there has been this thing on the internet about the vaccines are going to decrease people's fertility. Not so much. There is no data that it decreases fertility, and now we are many months past the original 40,000 people who were in the Pfizer and the Moderna studies. They've been followed for their fertility, and their fertility seems to be not affected at all. There was this unusual thing suggesting that the spike protein of the virus and the protein that's on the placenta were the same. They are clearly not the same, and there's no data that it affects fertility at all. So you can imagine if you're a young woman wanting to have a baby sometime in the future, that the idea that this could affect your fertility would be very worrisome. There is nothing to that. So again, if young women want to get the vaccine, they really should. All right, that looks like it for questions. Well, thank you all for joining us. We'll do this again next Tuesday. We're not going to do Fridays over the weekend, but we'll do next Tuesday. So you have questions, please put them in at Facebook questions at douglaspublichousenetwork.org, and we'll get to them. But in the meantime, as we've always asked, be safe and be kind. This has been a really, really tough time for a lot of people, and tempers can flare. But I would ask people to be safe and be kind, and we'll see you next Tuesday. Thanks. What did you think? I didn't take much of a breath.
Yeah.